Hello everyone, I'm Vanessa Grout, and today we will be interviewing Heather Marquis. She is the Infection Control Registered Nurse here at Piedmont Medical Center, and we will be talking about hospital-acquired infections. Thank you for agreeing to the interview, Heather. Now to start off, what is one thing that you love about your job?
I love learning something new every day, because this is a relatively new role for me. I've been a nurse for 6 years, almost 7.
Okay.
And I used to work on PCU.
Oh, okay.
Yeah. And then I went to the stroke coordinator role for about a year, and then I came to infection control. So this is a brand new position for me, brand new opportunity for me.
Right.
So I'm learning something new
every day. That's good.
Yes,
That's good.
Learning something new every day.
Now, what are some hospital-acquired infections here at the hospital?
Some of the hospital-acquired infections that we have here at the hospital, the number one that we're working on right now is our C-Diff. We also occasionally have a MRSA infection, that has to be reported. We do have healthcare acquired pneumonia. We also have community acquired pneumonia. Those are just a few of the infections that we have here at the hospital.
Okay. And who is at risk for hospital-acquired infections?
Hospital-acquired infections, your population that's going to be at risk, especially for our C-Diff, not necessarily for the MRSA or the HCAP, the healthcare acquired pneumonia, would be our advanced stage, patients of advanced stage, patients that have extended hospitalizations or multiple hospitalizations, antimicrobial exposure, which would be our antibiotics, chemotherapy, immunosuppression, patients that have had GI surgeries and a personal history of C. diff, or gastric acid suppressing agents, which would be your proton pump inhibitors.
And can you tell us a little bit more about that?
Sure. The proton pump inhibitors, recently, they have the documentation that's out there, the literature that's out there suggests that proton pump inhibitors increase the risk of C. diff. And so if you look at the clinical practice guidelines on stress ulcer prophylaxis, originally stress ulcer prophylaxis was created, one of the reasons was for patients that were admitted to the ICU to help prevent those patients from getting stress ulcers.
Okay.
But over the years, everybody in the hospital gets a proton pump inhibitor.
Right.
Proton pump inhibitor, stress ulcer prophylaxis. So we are currently working with our antibiotic stewardship team on helping decrease those rates. Sometimes patients have to have them. It might be a home medication, different things like that. But we are really actively working on decreasing the use of the proton pump inhibitor to help reduce the C. diff rate.
Okay. And when an infectious disease is identified and diagnosed, what are some of the protocols that staff members and family members must follow here?
When an infectious disease process is notified, the lab, whether it be MRSA, it could be C. diff, the lab will notify, once the order is placed in the computer. For our C. diff patients, they're automatically placed on enteric precautions. For our, if we're screening for MRSA, we screen everybody for MRSA that comes to the hospital. We wait until the test is done because it's so rapid. We can get that test result within a couple of hours. But for our C. diff patients, they're on enteric precautions immediately, and we, once the specimen is sent down to the lab, if it's appropriate, it needs to be completely liquid stool. The lab will run the test, and if it's positive, they will call the floor, let the nurse know, and then the nurse will call the physician and let them know of the result. Right. Now, if it's negative, they would call, let them know that it's negative, and you could take, if it were a C. diff patient, you could take them off the enteric precautions.
Correct. So. And now that also has to be 3 consecutive loose stools.
No, just one.
Just one. Okay.
Yep. Our test is it's very sensitive. It used to be a couple years ago. It used to be.
Okay.
Yep. But we switched to a rapid test, a PCR test.
Oh. Okay.
And that is the it tests for the gene.
Oh, right.
C-Diff. So it is also a rapid test. But C. diff is one of our higher problems in the hospital. So as soon as the patient comes in, and even if we're just ruling it out, we automatically place that patient on enteric precautions.
Correct. Okay. And as a nurse, what are some of the signs and symptoms that we should look at?
Signs and symptoms for patients with C. diff, they would have 3 liquid stools in the last 24 hours. I will stress liquid. It needs to be a liquid stool. We need to have liquid or watery diarrhea, fever, leukocytosis, nausea, abdominal pain. Taking a look at the patient, but you also want to make sure that you're looking at the patient. Are they taking Colace? Are they?
Okay.
Or do they have a GI prep? Are they looking at all of those?
Right.
Are those things causing the patient to have diarrhea? But those are some of the signs and symptoms that we would look for in a patient.
Good. And why is it important to educate clients about hospital-acquired infections?
Hospital-acquired infections are something that we are trying to decrease. So by educating our patients and family members and visitors, hopefully we can decrease the hospital-acquired infections.
Okay. And what are some preventative actions that one can take to help reduce the risk of hospital-acquired infection?
The number one thing that you can do is wash your hands with soap and water. I can't stress that enough. Wash your hands with soap and water, foaming in, foaming out when you're going into patients' rooms. But that is the number one way to reduce the risk of
C-Diff or
any kind of disease. Any kind of disease at all.
That's right.
So,
okay. Well, thank you very much,
welcome.
Heather. I appreciate it. Thank you, guys.